Most reactions to insect bites and stings are mild, causing little more than redness, itching, stinging, or minor swelling. Rarely, insect bites and stings, such as from a bee, a wasp, a hornet, a fire ant, or a scorpion, can result in severe reactions. Some insects also carry disease, such as West Nile virus. For mild reactions, to take care of an insect bite or sting that causes a mild reaction, move to a safe area to avoid more bites or stings. If needed, remove the stinger. Wash the area with soap and water. Apply a cool compress. You can use a cloth dampened with cold water or filled with ice. This helps reduce pain and swelling. If the injury is on an arm or leg, elevate it. Apply a 0.1 or 1% hydrocortisone cream or a baking soda paste to the bite or sting several times daily until your symptoms go away. You may take an antihistamine, Benadryl, others to help reduce itching. Usually, the signs and symptoms of a bite or sting disappear in 1 day or 2. If you are concerned, even if your reaction is minor, call your doctor. When to seek emergency care, call your local emergency number if the injured person experiences difficulty breathing, swelling of the lips, eyelids, or throat, dizziness, faintness, or confusion, rapid heartbeat, hives, nausea, cramps, or vomiting. Ask the person if he or she is carrying an epinephrine audio injector, an EpiPen, to treat an allergic attack. If the person says he or she needs to use an audio injector, ask whether you should help inject the medication. This is usually done by pressing the audio injector against the person's thigh and holding it in place for several seconds. Loosen tight clothing and cover the person with a blanket. Don't give him or her anything to drink. If the person is vomiting, position him or her to prevent choking. Begin CPR if the person shows no signs of circulation, such as breathing, coughing, or movement.